Dave Toycen, CEO, World Vision Canada. Can you tell us where we are and what we're seeing here?
We're in a town, a reasonable town called Toycen, and it's not far from Sukur in Sindh province. The goal here today is to feed, or provide provisions rather, for 500 families. That's 100 kilograms of rice, 4.5 kilos of vegetable oil, and then 4.5 kilos of high-energy biscuits for each family. Average family size here is, they say, about 7 people. These are people that are coming from different camps to this one congregating point to get their supplies for the next month. This is the last family for a month. And as you can see, these 100-kilogram bags of rice are heavy. And that's just one example of what people have to deal with, just getting this back to their homes. But of course, it's a place of hope. It's an opportunity for people to get food.
And what sort of condition are they in, Dave?
Well, these groups here have been getting some help. So in terms of our assessment as a team, their health is relatively good considering the environment that they're in. But of course, if the food distribution were to stop, if the supplies were to stop, they'd be in deep trouble. Our concern, of course, is to get them back to their villages as quickly as possible so that they can restart their normal lives, rebuild their lives, rebuild their livelihoods.
Dave, we're seeing a lot of men here. What about the women and children?
Yes, one of our concerns is always that the women and children, we make sure that they get access to the food first. But here, the cultural style is for the head of the household, the man, to be here. And so obviously we're being very careful to ensure that the food that's taken by the head of the household goes back with his family, with the mother and children.
Dave, what have you been hearing from our health people about the status of children's health in particular?
Well, we have some grave concerns about the health of children. They're always the most vulnerable in these situations. What's happening is if there's a shortage of food, for example, they're the quickest to suffer. Unclean water, diarrhea is really harmful to young children. In fact, it can lead to death sometimes because of and then dehydration, lack of clean water here. All these things are really important. We're concerned about the babies especially. Some of the mothers now are so dehydrated. They've had so little food that they're unable to nurse their babies. So these are all issues that affect the health of children, and we're very concerned about it, obviously.
Dave, we're seeing a large distribution today. Do we have the wherewithal to sustain this level of distribution?
Well, there's at least 2 levels of this distribution. One is obviously just the big commodities like rice, for example, that's being distributed here. Our understanding is that the World Food Program does not have an adequate supply. Long term, they need more food into the country. So that's one concern. The other one that concerns us a lot is from the reports we've received, there's no therapeutic feeding available for children at the moment. These are children who are more severely malnourished. It's a special kind of food preparation for them to deal with that problem. And according to our staff here, there's nothing available. So that's really critical in terms of the health of children. It's something we're very concerned about.